Hello, hi, I'm Dr. Arthur Bregman. I've been practicing psychiatry in South Florida now for over 40 years. As you know, the world of healthcare has been shaken in recent weeks with the spread of coronavirus throughout the world. Because of the mounting anxiety that many are feeling, I'd like to share some insights I've gained while treating patients with an innovative virtual approach to healthcare delivery through the internet. Now's the time that many people are feeling anxious and out of control. Feeling fearful and full of dread are common emotions. With so much uncertainty, it's completely normal to feel concerned or even scared right now, especially for those who are suffering from mental health issues. Let me share some advice that comes from decades of living in Florida, and all of you living in the Sunshine State and on the East Coast will understand the message. It's about getting prepared like we do before a hurricane. Remember, being prepared is the key to survival when fighting fear. When you're prepared and you have all your plans in place, you can breathe again. Panic will turn into peace. In order to help you feel prepared and secure, I've put together a list of some key points to keep that storm in your mind from becoming a Category 5 hurricane. So let's get going, okay? First and most importantly, you gotta make your plan. Everybody's gotta have a plan. Write out a list of all the supplies you need to get you by for at least 2 weeks. Like we do when we're doing a hurricane's coming. But here it's a little bit different. You'll need to think of food, of course. Prescription meds, those get 3 months worth. Also remember to have soap, hand sanitizer, tissues, and look, let's relax when you're in the stores. Don't hurry. Even go with a companion. Refer to your list. Keep it on your phone. Keep it in your hand. You can always go back if you get something. Being proactive, stay in control is the best way to lower your anxiety level. Next, assess your risks. Be realistic about these things. The best way to do that is get a true perspective about the situation, not a fantasy or some hysteria. We know that the majority of the cases are mild, and most people will experience symptoms similar to the common cold. In fact, Harvard Health reports report that most people who get sick will recover from this virus with no problems. So, many of the severely affected so far have been the elderly and people with underlying health problems. If you're over 60 and suffer from chronic illness, especially respiratory problems, or you're immune deficient, stay inside. We call it isolate. Now, isolate's not so bad. We could do it. It's time to read a book. How about all your hobbies, gardening, or whatever you want to do? If you keep your mind busy, you'll have less time to worry. So stay active, be busy. That'll keep you in control. Now, number 3, if you have a plan, you won't be surprised. If you want to change your plan, make sure it's something that you really need to do. If you have a schedule for you every day while you're in quarantine, stick to it. Stick to your daily routine. Keep from getting cabin fever, keep active. Unless you become sick enough to go to the hospital, stay home and enjoy time off. Do things around the house, enjoy things, play cards, do whatever you do. Get those projects done that your significant others wanted you to do. Get it done. Okay, now here, this is it. Now we're on 4. Like we do in a hurricane, you gotta listen to the right stuff. Reputable sources. Like the CDC, get a hold of them, and state agencies. They hand out accurate information. And remember, if things get bad, just put your time down to small increments. Like you say to yourself, I can get through the next 15 minutes. When we were sitting under the bed during Hurricane Andrew, we'd say, let's just get finished with the next 5 minutes. And it works. Take control of your information by relying instead on state and local health departments' social media pages and websites for timely information. The U.S. Centers for Disease Control, that CDC I mentioned, that's your best source. Above all, keep calm. Easier said than done, of course. After all, you got a plan. We talked about that. And when you have a plan, you're in control. So if you get worried, don't beat yourself up. However, if you find yourself too overwhelmed, get professional help. Online psychiatry guarantees treatment for those unable or unwilling to leave home. The coronavirus will not last forever. All storms, whether they be health-derived or hurricanes, take their course and eventually they die off. Life will return to normal. That you can count on.
BregmanMD Medical Group offers online psychiatry and online therapy.